WHO's commitment is to science, solutions, and solidarity. Our commitment is to supporting all countries to save lives. That's it. That's our intention. That's what we are for, saving lives. We have spoken previously about the factors countries must consider as they plan to start lifting the so-called lockdown restrictions. We want to re-emphasize that easing restrictions is not the end of epidemic in any country. Ending the epidemic will require a sustained effort on the part of individuals, communities, and governments to continue suppressing and controlling this deadly virus. So-called lockdowns can help to take the heat out of a country's epidemic, but they cannot end it alone. Countries must now ensure they can detect, test, isolate, and care for every case and trace every contact. We welcome the accelerated development and validation of tests to detect COVID-19 antibodies, which are helping us to understand the extent of infection in the population. WHO is providing technical, scientific, and financial support for the rollout of seroepidemiologic surveys across the world. Early data from some of these studies suggest that a relatively small percentage of the population may have been infected even in heavily affected areas, not more than 2 to 3%. While antibody tests are important for knowing who has been infected, tests that find the virus are a core tool for active case finding, diagnosis, isolation, and treatment. One of WHO's priorities is to work with partners to increase the production and equitable distribution of diagnostics to the countries that need them most. To achieve that, WHO has worked with FIND, the Foundation for Innovative New Diagnostics, and the Clinton Health Access Initiative to identify and validate 5 tests that have been validated and can be manufactured in large quantities. Working together with the Global Fund, UNICEF, and UNITAID, we have now placed orders for 30 million tests over the next 4 months. The first shipments of these tests will begin next week through the United Nations supply chain we have established with the World Food Programme and other partners. Solidarity flights continue to ship life-saving medical supplies across Africa to protect health workers who are on the front lines in the effort to save lives and slow the pandemic. Over the past week, WHO has been working closely with the World Food Programme to deliver masks, goggles, test kits, face shields, and other medical equipment to 40 countries. This is part of the overarching drive to keep supply chains moving and ensure key supplies reach 120 priority countries. Through April and May, we intend to ship almost 180 million surgical masks, 54 million N95 masks, and more than 3 million protective goggles to countries that need them most. I also want to highlight the JACMA Foundation's donation of 100 million masks, 1 million N95 masks, and 1 million test kits to WHO. We had a very productive discussion with JACMA yesterday, and he would like to continue to support countries in need. We're also continuing to lead research and development efforts. So far, more than 100 countries have joined the Solidarity Trial to evaluate therapeutics for COVID-19. and 1,200 patients have been randomized from the first 5 countries. This week, we expect that more than 600 countries will be ready to start enrolling patients.